Now, when we're talking about gloves, it's not recommended that you're using gloves in any open area because, honestly, they can spread disease and do more harm than good. Washing your hands with soap and water is much more effective in the spread of COVID-19 than wearing gloves. If you're in a specific place that requires the use of gloves, such as a lab, you can go ahead and use them. While you're cleaning your space, again, you can use gloves. If someone is telling you and is instructing you to use gloves, go ahead and do so. When you're done using your gloves, you must wash your hands. Like I said before, it's important that you watch your distance and stay 6 feet away from people at all times. Any social gatherings must be less than 10 people. If you see any floor markings in any buildings, please be sure to follow them. Getting in a small area, such as a car with your friends, is not permitted. If you're working and studying at any tables in a room with more people, make sure you're sitting farther away from each other, again, 6 feet away from other people. If you're able to, try and sit staggered, not all in a line next to each other. If you're eating at a cafeteria, don't all eat at one table in a circle. Try eating in a separate private area or outside. If you really need to sit down with another person for a class to do work or study, try using an online platform instead. Please be sure to follow any maximum number of persons, like in elevators or in rooms, and follow those guidelines. When you're cleaning and disinfecting, you're cleaning germs, any dirt, anything that is soiled, you should be cleaning. You're not necessarily killing germs, you're just removing them. And if there's less germs, then there's less of a risk of spreading the disease. When you're disinfecting, that means you're using chemical, EPA certified disinfectants to kill germs on any surfaces. Again, you're not killing every germ that's on the surface, but you are heavily reducing it, again, reducing the spread of COVID-19. How often should you be cleaning surfaces? Any surface that's a high-touch area that people come in contact with often, these surfaces are such as tables, doorknobs, light switches, any type of handle, desks, toilets, faucets, sinks, your phone, any electronics that you use. All of these are high-touch areas, and you should be cleaning them all at least once or twice a week. Or if it's becoming dirty, go ahead and clean it immediately. So what do you need to use for a safe disinfectant use? RIT has provided an EPA-approved disinfectant to use around the university. And FMS will go ahead and install these bottles with this disinfectant in classrooms. And you don't need to use gloves if you're going ahead and cleaning them. If there's something on your hands that's bothering you, you can go ahead and wash them. It's important to wash the surface area with soap and water, and then if it's not enough, you can go ahead and use this pathicide that RIT has provided. Go ahead and spray it on the surface and leave it for 10 minutes until it becomes dry. Any screens, phones, or touch surfaces, any liquid sensitive product, you can go ahead and spray the pathicide on the paper towel and wash it with the paper towel, and be sure to leave it for 20 seconds after you've cleaned it. If you feel sick, you should be staying home. By filling out the daily health screen, you'll be able to tell RIT if you're feeling any symptoms, and you can contact the Student Health Center, again at 585-475-2255, and they'll be able to follow up with you. Students may need to self-isolate if they're feeling symptoms. If someone has been exposed to COVID-19, they must stay home, and again, someone from the daily health screening team will contact the student and make sure that they're okay, and let them know if they need to quarantine or isolate. What is the difference between isolation and quarantine? Isolation means you're completely separate from other people, and you're isolating from other people to make sure that they do not get sick. If you're quarantining, I'm going to pause it.
Yeah, sorry.
That's okay. I'm going to go back 10 seconds also.
Yep.
A quarantine means that you're separating and restricting other people who might have been exposed to COVID-19. If they feel okay after a few days, then they're okay to go ahead and rejoin the community. This means you might be able, if you're staying in a dorm and you're quarantined or isolating, RIT will move you to a specific area specialized for isolation. It's a separate living space. If you live off campus, you will be expected to stay in your residence off campus. If you don't have an adequate isolation or quarantine space, the Department of Health in Monroe County will help you find a place to isolate. If you may have been exposed to COVID-19, there's contact tracing. Someone that has, again, I'm going to pause it. Someone that has tested positive for COVID-19 will be contact traced, meaning anyone that has come in contact with them will be advised to this information. Okay. 3, 2, 1. They'll be contacted, checking about their health, finding out who they've been come in contact with, and then letting them know if they need to isolate at home or not. It's important that you go right away and tell people details of where you've been in the last couple of days. And if you might have been exposed to COVID-19, again, someone from the health department or RIT Student Health Center will go ahead and contact you to let you know that you might have been exposed to COVID-19 and review steps that you need to take to self-quarantine. The RIT community expects us to follow in compliance with this contact tracing and provide the correct information related to other people who might have been exposed on campus. In terms of location check-ins, RIT has set up a location check-in app. It's a web-based app to use specifically when you're on campus to help people contact trace. RIT will be using QR codes, which will apply to specific people's locations, whether it's a classroom or office, and people that are coming on and off RIT's campus will need to check in with these QR codes. Faculty, staff, and students must scan this QR code through the web browser and fill out the information for this location check-in every single time that they come into an area with one of these QR codes. In terms of non-compliance, RIT has taken it very seriously that we follow these COVID guidelines. It's important for all of us to follow the rules and take actions and be role models for other people. If you notice someone exhibiting concerning behavior, it's important that you go ahead and report this. We do have a central reporting system available for all of the RIT community beginning on August 3rd of 2020. Anyone can report behavior that seems concerning. You can go ahead and fill the form out. Student cases will be managed by RIT Student Affairs, Accountability, and Conduct. You do not have to go up and approach someone if they're being non-compliant. This department will take care of it. Your mental and emotional well-being. The COVID-19 pandemic has impacted many people's lives, including students as well, and it can be an incredible impact on your emotional and mental health and can result in stress. It can have an impact on your grades, on your anxieties and your fears. And it's important that you know that there are resources and services available here to support you. Some examples of these resources are counseling and psychological services, the Student Health Center, the Spirituality and Religious Life, and the New York State COVID-19 Crisis Line. And lastly, the mental health, through the CDC, they're tracking mental health related to COVID-19 as well. Contacts and resources and correct timing in terms of your feelings is important in maintaining this. Sharing your information, opening safety plans, and knowing best practices. Any questions and answers to other COVID-related information, you can find this on www.rit.edu/ready. If there are any more questions, RIT has set up a call center at 585-475-3500 or 1-833-323-0002. All members of the RIT community are required to follow this pledge. The RIT pledge has 3 components. I commit to protecting myself and others by wearing a mask in public and washing my hands frequently for at least 20 seconds for each wash, and using hand sanitizer. To make sure you're watching your own physical space and maintaining 6 feet of distance at all times possible, and preventing the spread of COVID-19 by practicing daily self-care, keeping your shared spaces clean, and using the Daily Health Screen website before ever coming onto campus. Also by using the contact tracing and QR codes whenever you're moving from space to space, keeping your healthcare provider or RIT Student Health Center or any Rochester Regional Health Office, keeping them up to date if you have any COVID-19 symptoms, that you're staying home if you feel sick at all. And I'm prepared to keep others safe by staying informed and learning about the COVID-19 pandemic, following university guidelines, following any signs and directions in buildings on campus, keeping my personal things clean, and bringing, again, hand sanitizer and masks with me. Together, we can stay RIT ready and reduce the spread of COVID-19.
I'll stop recording.